My name is Dr. Winstar Ombuki. I'm the consultant urologist at Aga Khan Hospital, Kisumu. At Aga Khan Hospital, Kisumu, we provide screening services, diagnostic services, preventive treatment and follow-up of urology patients. The common conditions we treat include men's health conditions such as premature ejaculation, erectile dysfunction, evaluation and treatment of male infertility, common cancers such as prostate, bladder, kidney, and scrotal swelling such as hydrocele, varicocele, and even cysts that can have some painful conditions in the scrotum, and even testicular cancer, though rare. And for women, we treat things like recurrent UTIs, involuntary leakage of urine, incontinence, and overactive bladder, among other conditions. So for the various conditions, treatment is individualized. There's no one way of saying this is how we treat something. So it will start with the lifestyle changes, depending on your condition and the severity of your condition. Lifestyle changes, an example is patients who have prostate enlargement. If they don't have severe symptoms or bothersome symptoms, we will advise them about food restriction. I will advise them about their holding patterns, and that way they don't need any medication. But for those patients who require medication, we will offer them medication. And only for those patients who actually need surgery that will offer surgical interventions. And for surgery, at Aga Khan Hospital, Kisumu, we plan to offer the minimally invasive surgical options that ensure that this patient has less hospital stay, quick recovery to work, and even minimum blood loss. So, diagnosing any urological condition, we begin with a thorough history. We'll have a conversation with you about your symptoms and signs, where we ask various questions, and then we proceed to do a physical examination and appropriate laboratory and imaging tests. And then after, we will advise you on the best way forward in terms of managing your condition. We're in touch with the latest technology in the world. We attend the various conferences, and actually at Akhk, we want patients to have minimal stay in the hospital because we understand the need for you to get back to your families, to get back to work, recover quickly and get on with your life. So most of the procedures that we offer under urology is minimally invasive. We offer laparoscopy services, keyhole surgeries. If it is a procedure like prostate enlargement, we rarely open up to remove the prostate. We use the machine where we do a transurethral resection of the prostate, and they also stay at least 2 to 3 days with good outcomes. We offer a holistic approach whereby we're actually in touch with not just your condition. We want to understand your social status, your total well-being, because health is not just that condition that we're treating. And we have a good team where we have the supportive term, and we don't do it as a solo effort. We have the physiotherapist who will get you equipped after the operation, we have the nursing team, and various other specialists, even physicians. So sometimes a man over the age of 50 has other conditions, as maybe high blood pressure. So we ensure that you're really taken care of by everyone, and this ensures a good outcome. So for general advice for good urological health, I would advise people to exercise. An example in terms of prostate cancer, we've seen in a large Swedish study that 50,000 men were followed up, and showed that men who exercise followed up in 7 years, the risk of prostate cancer was reduced by 60%. So exercise, good diet is very important. With good diet, you'll have important chemicals like antioxidants that prevent things like cancer. So good exercise, and you also need to have a good sleep so that your body can always regenerate and give you good immunity. So to see a urologist, I know sometimes people assume that to really see a urologist you must have symptoms. That is not the case. Sometimes it's important that you come for just even advice, preventive advice, consultation, to know the state of your health, and also to really cure any condition that you could be having. And we do know that not all conditions present with symptoms. An example is prostate cancer. Prostate cancer can present with symptoms or with no symptoms. So it's important to have that check. And for men who want to have prostate cancer checks and to have a discussion, inform the decision making for screening, from the age of 40, we will encourage men to have a PSA screening. And for men who may be suffering from erectile dysfunction or any other men's health conditions, you are free to come and discuss with us. These conditions can be managed. At AKHK, we are at your service, and you are welcome for us to take care of your urological health.